Guys, in this video, let us look at this Hypopyon corneal ulcer. It is also called as ulcus serpens. Okay, basically this is nothing but the corneal ulcer, which is because of the bacteria Streptococcus pneumoniae. Okay, caused by bacteria Streptococcus pneumoniae. Okay, that is nothing but pneumococcus. If it is because of this bacteria Streptococcus pneumoniae, the corneal ulcer or the keratitis is because of Streptococcus pneumoniae, it has a special name, that is Hypopyon corneal ulcer. There's really nothing great about this terminology, right? Hypopyons would be there in many other corneal ulcers, but somehow when they ask Hypopyon corneal ulcer, you have to write this, which is caused by Streptococcus pneumoniae. All other bacteria, guys, which like Staphylococcus, Streptococcus, Gonococci, Moraxella, Pseudomonas, all those bacteria, they're simply calling it as bacterial corneal ulcer. And there they can say it is corneal ulcer which has Hypopyon. But if it is Hypopyon corneal ulcer or ulcus serpens, it is because of Streptococcus pneumoniae. So look at this image. Where is the Hypopyon here? Here you can see the Hypopyon, that is pus in anterior chamber, that will have only WBCs, there will be no bacteria in it. This is the ulcer. You have understood what Hypopyon corneal ulcer is, also called as ulcus serpens. Okay, we have already covered videos on bacterial keratitis, bacterial corneal ulcer, Hypopyon, everything, separate videos are there. So whenever there is Streptococcus, Staphylococcus, there will be white ulcer, they are saying. Remember, Streptococcus pneumoniae is ulcus serpens or Hypopyon corneal ulcer. Okay, what is special in this? What is special in this Streptococcus pneumoniae caused? Because the source of infection is the lacrimal sac. Okay, so that's what you have to remember here. What exactly is the source? So the source of infection for pneumococcal infection is dacryocystitis, chronic dacryocystitis. We are talking about Hypopyon corneal ulcer. So where is the lacrimal sac? Here you have the lacrimal sac, right? So some chronic infection of this, usually if it is by chance by this pneumonia, Streptococcus pneumonia, it is going to affect what? The cornea and cause bacterial keratitis, which is because of this Streptococcus pneumoniae that has a special name called as Hypopyon corneal ulcer. It's also called as ulcus serpens. Going back here, so you know the source of infection. Here, what are the factors? The virulence of the infecting organism and the resistance of the tissues. These are the factors, risk factors. Usually in old people and alcoholic subjects, you could see. In chronic conditions, it will end up affecting. Special points that you consider, Hypopyon corneal ulcer. Special points, secondary glaucoma. Obviously, for all Hypopyon corneal ulcers, they are saying secondary glaucoma, right? And you will treat it with what? Acetazolamide or timolol maleate. Source of infection, if it is chronic dacryocystitis, you should treat with dacryocystectomy. So secondary glaucoma, and how will you treat it with? How will you treat the glaucoma? With acetazolamide, timolol maleate, and dacryocystectomy. This is the treatment, right? Guys, all the other points about bacterial keratitis, bacterial corneal ulcer, everything stays good. Okay, these are some extra points that they are telling. So if you want complete information, you must go to this bacterial keratitis video and learn everything there. Okay, you saw what the stages are and what the signs are, then the complications, how to manage, right? Everything is same as that. Only thing here you have to know is it is by Streptococcus pneumoniae. It's called as ulcus serpens. It has a tendency to creep over the cornea. The ulcer has a tendency to creep over the cornea. Violent iridocyclitis it can lead to. Okay, it can lead to violent iridocyclitis. Ulcer spreads rapidly and has a greater tendency for perforation. So it can lead to perforation. So what and all are they telling here? This one is kind of very spreading very rapidly. It can creep over the cornea. It can cause violent iridocyclitis, and there is greater chance of perforation. Also, what and all they said, secondary glaucoma, right? So basically treat the source of infection, that is treat the lacrimal sac. You can remove the lacrimal sac, which they are calling it as dacryocystectomy. Okay. Anything else that we want to cover? No. Everything else we have covered in other specific videos about hypopyon, etc. Remember again, this is a hypopyon because of bacteria, so it will be sterile. Why will it be sterile? Because bacteria cannot cross the Descemet's membrane. So let's just finish off this video with some little, see, this is the anterior chamber. Here the white leukocytes are collecting, that is hypopyon, right? And this will not have any bacteria because the bacteria cannot cross the Descemet's membrane, right? They cannot cross the Descemet's membrane. So this hypopyon will be sterile. And because of this hypopyon which is collecting in the anterior chamber, what will happen? The intraocular pressure will rise. So it can lead to secondary glaucoma. How will you treat it? By treating the source, that is dacryocystectomy you will do. Another thing is, when it is because of streptococcus, it will be a white ulcer, right? With the surrounding clear cornea. That's what they say about streptococcus. Quick recap, Hypopyon corneal ulcer or ulcus serpens, it is because of this pneumococcus, that is Streptococcus pneumoniae. It has a tendency to creep over the cornea. It can cause hypopyon, which is sterile, and the ulcer rapidly spreads and it can lead to perforation, violent iridocyclitis it can cause. Then what else? The source of infection is the chronic dacryocystitis. Factors are the virulence of the organism and the resistance of the tissues. So you will see it more in old debilitated or alcoholic subjects. When you are treating, the extra points that you have to consider are secondary glaucoma, and you remove the source of infection. So you do a dacryocystectomy. That's all for now. Bye bye.